Are you tired all the time? Gaining belly fat even when you don't eat that much? Has your doctor mentioned elevated liver enzymes? You might be facing something millions of people are living with, often without knowing it: fatty liver. The good news: in most cases, especially early, you can reverse it. And in this complete series from iHealth Consult, I'll show you exactly how. Before we dive in, hit subscribe and turn on notifications so you don't miss the full Fatty Liver Reversal series. Your liver will thank you. 1. What is fatty liver in simple words? Your liver is a hard-working chemical factory. It processes food, filters blood, builds proteins, balances hormones, stores vitamins, and helps manage blood sugar and fats. When too much fat builds up inside liver cells, more than about 5% liver weight, it's called fatty liver. For most people, this happens silently. Two old and new names: NAFLD, MASLD. You may have heard the older term NAFLD, non-alcoholic fatty liver disease. Experts recently shifted toward the new name MASLD, metabolic dysfunction-associated steatotic liver disease. Why the change? Because in most people this condition is strongly linked to metabolic problems: belly fat, insulin resistance, high blood sugar, abnormal cholesterol, and high blood pressure. In short, it's not just about alcohol, it's about metabolism. 3. How common is it? Globally, fatty liver has exploded alongside rising obesity, processed food diets, and sedentary lifestyles. In some countries, 1 in 3 adults may have fat in the liver, and many don't know it. It's also rising in younger people. If you have belly fat, prediabetes, type 2 diabetes, or high triglycerides, your risk is higher. For why should you care? Fatty liver isn't just a liver issue. It's tied to weight gain and stubborn belly fat, blood sugar problems and insulin resistance, cardiovascular disease risk, chronic inflammation, fatigue and low energy. In advanced cases, liver scarring, fibrosis, cirrhosis, liver failure, and even liver cancer. Most people never get that far if they take action early. That's what this series is all about. 5 early wins are possible. Here's the best part. Studies show that losing just 7 to 10% of body weight can significantly reduce liver fat and even improve inflammation. Even smaller improvements, like cutting out sugary drinks or walking daily, move you in the right direction. 6. What you'll get in this series. In this complete guide, you'll learn what fatty liver is and how it develops, who's at risk and early warning signs, how doctors test and diagnose liver fat, the critical role of insulin resistance and belly fat, evidence-based diet and nutrition strategies, 7-day liver-supportive meal plan and grocery list, exercise routines for all fitness levels, including 60+, safe review of supplements and what actually helps, myths, liver detox drinks, extreme cleanses, pills, a guided 90-day action plan to track progress. 7. What to do before starting. If possible, get recent labs, ALT, AST, GGT, fasting glucose, A1C, triglycerides, HDL, fasting insulin. Measure waist at belly button level. Record body weight plus blood pressure. Write down your current meds and supplements. 8. Safety disclaimer. Read clearly. This series is for educational purposes and is not a substitute for medical diagnosis, treatment, or personalized medical advice. Always consult your healthcare provider before making changes, especially if you are pregnant, have diabetes, take medication, or have known liver disease. What your liver does and how fat builds up. 1. The liver, your body's master metabolic hub. The liver performs over 500 known functions. Think of it as a traffic controller for nutrients, hormones, toxins, blood sugar, and fats. Key jobs: converts food into usable energy, stores glycogen, backup sugar fuel, produces bile to digest fats, builds blood proteins, albumin, clotting factors, filters toxins, drugs, alcohol, helps regulate cholesterol and triglycerides, balances hormones and inflammation messengers. If liver cells fill with fat, many of these functions slow or malfunction. 2. How does fat get into the liver? Fat can accumulate in 3 main ways. Too many calories/high sugar intake, liver converts excess into fat. Insulin resistance signals are broken. More fat gets stored instead of burned. Fat released from body fat stores, especially belly/visceral fat, gets delivered to liver. Add alcohol, certain medications, or viral damage. Risk multiplies. 3. Sugar, fructose, and liver fat. Liquid sugars, especially fructose-heavy drinks like sodas, sweet juices, energy drinks, are strongly associated with liver fat buildup. Fructose is primarily metabolized in the liver. Too much overwhelms it, triggering fat creation. 4. Insulin resistance. The fatty liver accelerator. Insulin is the hormone that helps move glucose into cells. When cells stop responding properly, insulin resistance, the pancreas pumps out more insulin. High insulin promotes fat storage, especially in the liver. That's why fatty liver often appears in people with prediabetes, type 2 diabetes, PCOS, and belly obesity. 5. Inflammation and oxidative stress. Excess fat inside liver cells can trigger lipotoxicity. The fat becomes chemically irritating. That leads to inflammation, oxidative stress, and in some cases progression to MASH, metabolic dysfunction-associated steatohepatitis, previously called NASH. That's when damage escalates. 6. The fatty liver spectrum. Simple fat, inflammation, fibrosis. Steatosis, fat in liver, little/no inflammation, often reversible. MASH, NASH, fat plus inflammation plus injury to liver cells. Fibrosis, scarring tissue forms. Cirrhosis, advanced scarring, liver function compromised. Cancer risk rises in some cases. Early intervention can stop this chain. 7. Can the liver heal? Yes, remarkably. When triggers are removed, excess sugar, heavy alcohol intake, severe calorie load, and you restore metabolic health, liver cells can gradually unload fat and recover function. Weight loss, improved diet quality, controlled blood sugar, and movement are powerful tools. MASLD, MASH and staging, understanding your diagnosis. 1. From NAFLD to MASLD, what changed and why? Historically called NAFLD because it occurred in people who drank little or no alcohol. But that label ignored the huge role of metabolic health. Now, experts use MASLD, metabolic dysfunction-associated steatotic liver disease, to reflect root causes like obesity, insulin resistance, and abnormal lipids. If liver fat plus metabolic risk factors are present, MASLD applies. 2. What about MASH? MASH, metabolic dysfunction-associated steatohepatitis, is when fat buildup in the liver causes inflammation and cell injury. This is more serious than simple fat storage. MASH can lead to fibrosis, scarring, if not treated. 3. Alcohol and mixed causes. You can have more than one liver insult, metabolic issues plus alcohol plus meds plus viral hepatitis. Always give your doctor a full history. Even moderate alcohol may worsen metabolic liver fat in some people. 4. Key lab tests and what they suggest. Common labs related to liver status. ALT, alanine aminotransferase, elevated may suggest liver irritation. AST, aspartate aminotransferase, also elevated in liver injury, ratio to ALT can be informative. GGT, enzyme linked to bile duct/liver stress. ALP, alkaline phosphatase, can relate to bile flow issues. Bilirubin, breakdown product, high levels may signal worse function. Note, normal labs do not always mean no fatty liver. Many people with liver fat have labs in range. 5. Metabolic labs that matter. Because MASLD is metabolic, also check fasting glucose and A1C, blood sugar control. Fasting insulin, insulin resistance indicator. Triglycerides and HDL, lipids. Waist circumference, belly fat marker. Blood pressure. 6. Imaging tools doctors use. Ultrasound, common, non-invasive, can detect moderate-severe fat but may miss early stages. Fibroscan, transient elastography uses vibration to estimate stiffness, fibrosis, and controlled attenuation parameter, fat. MRI-PDFF, advanced imaging, very accurate % liver fat but expensive. CT scan, not first line but may note fat. 7. When is a liver biopsy done? Rarely needed unless unclear diagnosis, suspected advanced disease, or insurance/clinical trial requirement. Biopsy shows inflammation, fat, and fibrosis level directly. 8. How to talk to your doctor. Take these questions. Do I have fat in my liver? What stage? Are my liver enzymes elevated? Do I meet criteria for MASLD or MASH? Do I need lifestyle changes only or medication? Should I repeat labs in 3 or 6 months? Diet, sugar, belly fat, sleep, stress and meds. 1. Calorie excess and weight gain. When we eat more energy than we burn, the body stores the extra, first as glycogen, then as fat. Visceral fat, around organs, is metabolically active and constantly dumps fatty acids into the liver. 2. Sugary drinks and refined carbs. Soda, sweet tea, energy drinks, packaged juices, pastries, white bread, these cause blood sugar spikes and high insulin. Fructose, in particular, is handled in the liver and easily converted to fat. 3. Ultra-processed foods. Foods high in refined starch plus seed oils plus sugar plus additives create a metabolic storm. You eat more, burn less, store fat faster. Reducing packaged snacks, processed meats, and dessert foods can reduce liver load. 4. Insulin resistance and metabolic syndrome. If you have high waist size, high blood pressure, elevated fasting glucose, high triglycerides, and low HDL, you may have metabolic syndrome. This cluster strongly predicts fatty liver. 5. Sleep and circadian rhythm. Short sleep and irregular sleep patterns disrupt hunger hormones and insulin sensitivity. People who sleep less than 6 hours regularly are more likely to develop metabolic issues. 6. Stress and cortisol. Chronic stress raises cortisol, which can increase blood sugar and promote abdominal fat storage, feeding the liver fat cycle. 7. Alcohol interaction. Even moderate alcohol may worsen liver inflammation in those with metabolic liver fat. If reversing fatty liver is your goal, consider alcohol-free months. 8. Medication and toxin load. Some drugs, certain steroids, chemo drugs, antivirals, older antipsychotics, can stress the liver. Never stop meds. Talk with your doctor. But support liver recovery with diet, hydration, and movement. 9. Your self-audit worksheet. Have viewers pause and list. Sugary drinks per week. Processed meals per week. Hours of sleep. Waist measurement. Alcohol frequency. This self-inventory becomes a baseline. Signs, symptoms, and when to see a doctor. 1. The silent phase. In early steatosis, many have no symptoms. Liver fat shows up on ultrasound or labs during routine checkups. 2. Possible early clues, nonspecific. Fatigue or low energy. Brain fog after meals. Mild right upper abdominal fullness, not pain, just pressure. Weight gain around the waist. Lab, elevated ALT or AST.